Good afternoon, and welcome to Artists of Color / Voices of Sisterhood. I'm your host, Elaine Hall-Corbin, and thank you for being with us this afternoon. Last month when I was on, we had lost a great person, Maya Angelou, and I was ecstatic about that. No, actually, I was really upset about it, and I wanted to pay tribute to her. And now this month, we've lost another female artist. We lost Ruby Dee about a week or so ago, and I also want to pay tribute to her. She was one of our legends and one of the greats. So we're going to miss you, Ruby. I know I am. So, just to say that, I want to say thank you to my guest today, Dr. Myechia Mintor-Jordan, who is the new president and CEO of Dimock Health Center in Roxbury.
Thank you.
Dr. Jordan, thank you for coming.
Thank you for having me.
I appreciate this so much.
It's wonderful to be here.
Thank you. I guess I want to start with, tell me a little bit about you, or tell my audience a little bit about you.
Sure. So I'm originally from New York. I went to school in Rhode Island. I went to Brown University, undergraduate medical school. I'm a physician. I'm an internist by training. I did my training at Johns Hopkins in Baltimore, Maryland. And then after my training, I went back to school and got a master's in business, particularly in healthcare administration. And I found out about the position at Dimock, the chief medical officer position, in 2006. And when I came here from Baltimore, I was blown away. And blown away not only by the patients and clients we serve, by the mission, by the then President Ruth Ellen Fitch, but also by the doctors and people that provide the services at Dimock, and knew that that was where I needed to be. So moved my family up to Boston while I was pregnant with my second child, and started a career at Dimock as the chief medical officer. And I became the president last July, and it's been a whirlwind ride, but I've enjoyed every moment of it.
What's it like being the president and CEO of Dimock? You know, give us a little insight. What is it like?
It's absolutely amazing. Every day I go home and I just feel like I'm one of the luckiest women in the world. Dimock is an incredible place, has been that incredible place for over 150 years in terms of working with the community and providing services, first as a New England hospital for women and children, and now as the Dimock Center. And it is, it's an incredible place with incredible people. We're the largest employer in Roxbury. We employ over 400 people from our community. So it allows us to have an impact on the community in many ways, both economically as well as in terms of healthcare, education, and behavioral health. So I couldn't be prouder of the work that I do. Every day is different. Putting out fires, figuring out how we can fundraise, how we can make sure that we maintain our visibility, but most importantly, making sure we can connect with the community. So it's an amazing job. I highly recommend it.
She says, I highly recommend it.
Not that I'm going anywhere anytime soon.
Oh, thank you. I don't think you could.
For whomever, 20, 50 years from now, it's just being the leader of a healthcare institution that has such an incredible impact on the community is just so rewarding, both personally and professionally.
Oh, that is so good. That is absolutely wonderful. You said when you first came to Dimock, you were blown away.
Yes.
How? You know, give me a little insight.
Yeah.
How?
So I think working in academia at Hopkins, a lot of people have a perception of community health centers as not having the most highly trained physicians, of being a place that you might not want to have your own care, have it delivered there. But what surprised me most of all was the level of dedication from the providers. From every person, every employee that I encountered, they loved what they did. They were passionate about it. And that blew me away. It blew me away in the sense that there were so many people who were just really engaged with the mission of making sure that we're healing and uplifting the community. So that in and of itself blew me away. All of the programs and services, how comprehensive they are. We don't just provide health care. And as a physician, being able to say to a patient, I can connect you to ways in which you can get housing, I can connect you to food, I can connect you to, if you're homeless, I can connect you into our shelter, I can connect you into recovery services. That's the way that medicine should be practiced as a physician. So that blew me away too, the opportunity to practice medicine in a way that I had never been able to before.
I'm hearing you, and I understand because, you know, Dimock is such a huge campus. I know there are times that I've gotten lost, okay, in there myself because I'm saying, well, you got to go this way, you got to go that way. But with you being at the helm now, do you have any plans for any changes, or do you want to see things, other things coming into the center that have not been there before?
Yes, if you ask any of my staff, they would say I probably have too many plans. Because I'm fast-paced, I'm a New Yorker at heart. But my vision for Dimock is that any person coming in will be able to understand how we can provide all of the services, wrapping around those services for the patient, for the family, for the child. My vision is that we are really changing the way we think about healthcare. It's not just about preventative health, primary care, but it's also about behavioral health. It's about substance abuse and recovery. It's about education as a means of empowerment. That's how we should be thinking about health. And so my goal is to make sure that we are collaborating across those program areas, child and family, behavioral health, health services, that we're also measuring our impact, that we're partnering with community, that we're partnering with academia, and that we're bringing all those resources into the community. So I am really trying to lay the groundwork for all of that, to make sure that we're visible, people know who we are, what we can do for them and with them, and that we're accessible. So really trying to make sure that the kind of care that we deliver is not only accessible, but also better than what you would get anyplace else, and that the quality of our services is high. So I'm excited to really lead an institution that is able to move forward and do those things and be innovative, looking at research. There's so many different roads we can travel down. It's pacing myself, pacing the institution that I have to do, but I have incredible staff that believe in that and believe in the mission and are carrying these things out as we speak. We are a 24/7 organization. Our halfway house is on our campus. People live on our campus.
Yeah.
So we are always there, we are always working, and our staff are incredible.
Yeah, I know they are. And I really do. I want to backtrack a little bit.
Sure.
You said you had done some training at the Johns Hopkins.
Yes.
Tell me what you brought with you from Johns Hopkins. I've heard a lot about Johns Hopkins.
Yes.
I've seen different things, but
Sure.
I want to talk to someone who's actually done the work there, has come there.
Hopkins, Harvard, they're both incredible academic institutions, and I think what I was able to bring from Johns Hopkins in particular is around quality improvement, how we look at how we measure ourselves. How can we tell that what we're doing actually works? How can we tell that the impact that we want to have on the community is actually happening? So how do we bring the data points together to show that is some of the background that I brought with me from Hopkins. The other pieces are around systems. How do we begin to look at systems? How do we make sure that we have all the right people in the right places? Is some of the work that I did there. Also around a research focus. African Americans in particular have had, reasonably so, have a fear of research because there have been so many things done to us as a people in the past.
That's true.
But there's research that we can do that will actually help to improve the way we practice medicine, the way we deliver education, the way we deliver behavioral health services. And bringing that angle of community-based participatory research is what I brought also to Dimock, and really trying to create an infrastructure for research that will allow our patients to participate in how we think about research, how we bring those results back, so that it's a partnership that really helps everyone in the end to really improve what we're doing.
Okay. And around that, the Black and the Latino community, they, as you stated, have a fear of the medical system. How, if any, how have you begun to try and work around that, or are going to work around that? What is your plan?
Yeah, that's a really great question. Part of it is all around cultural competence. And what I've seen in the short time that I've been at Dimock, which has been 7 years now, is that the demographics of our area are changing. Primarily when I got to Dimock, it was still primarily a Black organization, institution. Now it's really Black and Latino, and others, but Black and Latino are the major categories of the patients and clients we serve, particularly in the health center and in our educational facility. Part of it is making sure that we have people that look like our patients and clients providing those services. So at every level in the health center, even within our child and family programs, there are Spanish-speaking providers, Spanish-speaking nursing staff, Spanish-speaking front desk clients, employees, as well as interpreters to make sure that we are meeting those cultural competency guidelines to ensure that patients feel comfortable, clients feel comfortable. The same in our educational facilities. We have teachers that speak Spanish for our Spanish-speaking children. We do an inclusion model where we have Spanish words that are taught in the classroom to make sure that our children are learning the language. So we're trying at every level to make sure that we have people who look like our patients, clients, and families serving them, which I think is one of the first steps in trying to break down some of the barriers around the fear of the medical system. The other is around providing navigation services, making sure that when someone comes or calls the campus that we can help them to get to the services that they are looking for and speaking within their language.
All right. Giving a lot of information out there to to my audience.
Great.
And which we will continue. And again, I'd like to introduce my guest, Dr. Myechia Mintor-Jordan. Dr. Jordan, thank you for being with us today.
Thank you.
And I'm so glad you're here.
As am I.
Now, before we went on break, we were talking about, the impact of the health system to our community, and especially to the Black and the Latino areas of our community.
Yes.
Now, healthcare has been an issue. President Obama's talked about healthcare. And he's done now the Obama healthcare program.
Yes.
How has that impacted people of color in our community as far as coming to Dimock and being Dimock patients?
So one of the things is, as I go back and think about this question, one of the things that I reflect on is the healthcare reform that happened in Massachusetts when I first got here in 2007. And at that time, it was really amazing to me to practice in the clinic as a physician because I had patients coming in to say, I haven't had my mammogram, my colonoscopy, I now have health insurance, I want it all. So it was wonderful to see patients empowered to be able to get all of those things that they had not been able to get before because they now had health care insurance. So that was great. And we continue to see that over the years. Now with President Obama's Healthcare Reform Act, what we're seeing is there's an expansion of Medicaid or Mass Health, so more people are eligible for Mass Health and able to get on it so that they now have more options regarding insurance. And we then continually see more patients coming in. I think the biggest difficulty has been around all of the issues with the system, the website, and understanding how to navigate that, not only from a national perspective, but also locally from the state level, that there's been some difficulties with that system. And so one of the things that I appreciate, among others, regarding President Obama is his incredible support for community health centers. So not only has he allocated funding as part of the Healthcare Reform Act for health centers, which is how we received our grant for $4.9 million to renovate the health center. Oh. We can talk about that. It's so exciting.
Yes, I know.
It's really, really exciting. But he also provided health centers with some funding to do outreach and enrollment. Really? So we were able to hire an outreach and enrollment coordinator that not only goes out into the community, attends community events, but also can help patients as they come in to sign up for health care, understand what their choices are. So we are stepping up, as health centers should, to help the community understand how to navigate that whole process. So we're playing a large role in that. But the $4.9 million that we received, which was one of the best days of my working experience at Dimock, when we got that notice, I think I was jumping up and down and running around, just so excited. But we received that grant to renovate the health center, which had been renovated about 15 years ago or so, 15 to 17 years ago once. But this one allows us to double the size of our adult medicine clinic. It allows us to add more operatories to our dental clinic, so more exam rooms in dental, more exam rooms in our eye care clinic. It gives a facelift to the health center, but also allows us to do what's called a patient-centered medical home transformation. And what that means is that we can move behavioral health services into the pediatric clinic. We can move behavioral health services into our adult medicine clinic. Wow. So that a patient comes in, I'm seeing that patient as a doctor, and I notice that that patient has an issue, a mental health issue. I can walk out my room and see a clinician there, ask that clinician to come in and talk to my patient, and on the spot they can get engaged in behavioral health care services. So this is a very different way of practicing, and now that we have the space to accommodate that, we'll be able to be much more comprehensive in the way we provide services for adults and children. And we'll also have more space to take on more patients. So as you mentioned, before we started, we had community health centers close around us.
Yes.
Roxcomb closed, Martha Elliott moved from taking adult patients to only focusing on children. And so many people were displaced. Yeah, many people were displaced from being in care. And Dimock naturally is very close to both of those sites.
Right in the middle.
Yeah, exactly. We're right in the middle. And so we need the additional space to see more patients. But we also want to make sure that that space allows us to continue to be comprehensive in the way we provide those services.
Wow.
Yeah, so a lot happening
that is great.
from healthcare reform that for the most part is positive. I mean, there are always things that can have been done differently. There are things that we would continue to like to see around, malpractice reform. Those things weren't necessarily addressed in the Healthcare Reform Act, but there's still so many positive pieces, particularly for the community, around access, around ability to have insurance to get into healthcare.
Wow, that is wonderful.
Yeah.
I like that.
Thank you.
Now, this is a question I wanted to ask you. When a patient comes to Dimock for the first time, they've never been there before, they don't know anybody, what is a typical intake procedure like? So I don't remember, it was so long ago.
Yeah, you've been with us longer than I have, which is fabulous. It really depends on the service. So let's take, for instance, if a patient or a family member goes to our child and family and they want to enroll their child in Head Start, early Head Start, or their child has some issues where they need early intervention, then they would go through an intake process with a coordinator in our Head Start, early Head Start building, primarily the Jackie Jenkins Scott building that faces Columbus. That's where we have the majority of our child and family programs. So they may enter in that way. And then when there's a full process that has to happen where we identify what the children's needs are to make sure that we are fully addressing them. Also, what are the milestones that the parent or family may have for their child that we work together to design. There may also be a family that will come to us via our shelter. We have a shelter that houses 26 families in the shelter, which is also on our campus. We have a beautiful 9-acre campus, as many people know. If you're coming in through the shelter, that may be through the Department of Transitional Assistance through DTA. So our staff work collaboratively with DTA to get a family in. If someone is suffering from substance abuse, they may come off the street to us, to our detox, and ask to be enrolled in our detox program. They can also come from an emergency room, from a correctional facility, from another recovery program if they've had a relapse, into our detox program. There's an intake that will happen there. From that detox, that client can then go to one of our outpatient addiction programs, which some are partial programs, some are group therapy programs, or into one of our 4 recovery homes also on the campus. If you're going into the health center, you would meet with one of our front desk staff who would help you to complete paperwork. If there was an insurance question, then you could meet with our outreach and enrollment person that I talked about earlier to help them get onto insurance or navigate the insurance process. So any number of ways, but we have staff that's ready to do that no matter where you are and what you need.
Wow. There are many things I want to ask you, because we're talking about what goes on at Dimock and how one gets to Dimock and how one gets into Dimock, and there are so many programs.
Yes.
And there are a few that I know about but don't know about.
Sure.
So I'd like to ask you those questions and get that information out there to my people that are listening.
Of course, of course.
But, we're going to do that, Artist of Color, and to my guest, Dr. Myechia Mintor-Jordan. I got stuck there.
That's okay.
But we were having a conversation before we went on break about the procedures at Dimock and what one does to get into Dimock and what all the different programs that you have when one comes because of what they might have, what the issues might be for that particular family or person. What are some of the other programs that Dimock has?
Sure. So I can take a step back, and basically what Dimock has are 3 main program areas. The first, and in no order of priority because they're all important, is our health center. And the health center has adult medicine, pediatrics, OBGYN, an eye clinic, a dental clinic, HIV services that we call community care. We also have some specialty services like orthopedics. We have an endocrinologist that works with our patients, particularly in our pediatric clinic, around obesity issues. So there's some specialty services embedded there too.
We got a call.
We also, oh, should I stop for the call?
I think we got a call.
Okay, let's take the call.
Hello.
Yes, we're here.
Hi. I'd like to ask a question about the video I saw. I saw people who basically represented the third world community, and I wonder if you have Caucasians come.
Yes, we do. We're open to anyone and everyone. There's definitely no restrictions around who can use our clinic. I think what you've seen is basically what we see in the community primarily, but there are Caucasians that use our services, there are Asian Americans that use our services. We are completely open to anyone and everyone.
And I have one follow-up question, if I may.
Sure.
Could you tell me what happens to someone who may not have health insurance at this point? Maybe they're trying to get Obamacare, but they don't have it yet. What would you do with them? And
Sure.
can you help them?
Yes, most definitely. So part of being what we are a federally qualified health center, and part of that means that we will see anyone and everyone regardless of their ability to pay. And so if someone were to come to us without insurance, we would obviously connect them with the outreach and enrollment person to see if we can get them on any type form of insurance. But if they were not able to, we have what's called a sliding scale that is based on their ability to pay, and we would provide the services in that way.
Okay. And are all the services provided at the Dimock Community Health Center, or do you send them to other hospitals?
It depends on what the service is. The outpatient services are delivered at Dimock. If there are other specialty services that are required, then we have hospital affiliations with Beth Israel Deaconess, as well as Boston Medical Center and Children's Hospital primarily.
Very good. Okay, that answers my question. Thank you so much.
Thank you for calling.
Okay, bye-bye.
Yeah, and, you know, that was a question, and
Yes, I love
that was
it.
a couple of questions.
That was
that
really
was
a
great.
great question, too.
Yeah, they were.
Yes.
But I want to go back to what we were discussing.
Sure, the
as far
description
as,
of the
yeah,
services.
the services.
One of the things I was actually just about to say is we also have an on-site pharmacy. And as part of in follow-up to the question that was just asked, that pharmacy is fantastic. And I brought that on as Chief Medical Officer because we recognized that patients needed a place to get their medications on-site in collaboration with the doctor, so that if they leave and there's a question about the medication, it can be readily answered. Or if they can't afford the medication, one of the commitments that we've made is that if there's a medication that is needed, a medical necessity, that we will give the patient the medication regardless of their ability to pay. So some patients who can't afford their copay or can't afford to pay for the medication because they don't have insurance or are underinsured, we will give them the medication and help them to get on the right plan that will allow them to continue on that medication.
Okay.
So that's primarily the health center.
Okay.
When we think about our child and family division, that's Head Start, Early Head Start, preschool, and early intervention. We have 400 beautiful children that are on our campus every day. We had our Head
I
Start
see them all
graduation
the time.
today. It
They're
was
so beautiful.
beautiful. I was the keynote speaker at a Head Start graduation, so that's the
Were
life of
you?
a president and CEO. It was great to see those beautiful faces.
Oh,
So
yeah.
that's an amazing part of what we do. As part of that program area, we also have an adult GED program. So the parents, when they drop their kids off to Head Start and Early Head Start and preschool, can go in and participate in the GED program offerings that we have. So our idea, as I mentioned earlier, about health is really about education, empowerment, behavioral health, primary care, all of that together. So the education piece is really important because that's how we afford empowerment to the community. And then the final program area is behavioral health, and that's a lot of what we're known for. As I mentioned earlier, we have 4 halfway houses on our campus. We have a 30-bed inpatient detox also on the campus, a shelter that houses 26 families. We own a number of residences throughout the city for developmentally disabled clients, their group homes
Okay.
in
Know
Roxbury,
that.
JP, South End. We own a number of houses there. We also have an incredible home called Umi's, which is in Fort Hill, that houses women who have HIV, substance abuse, and mental health disorders, one of the only in the state. And it's an amazing house that was recently renovated thanks to amazing funders, the Franklin House Foundation in particular, that brought all new furniture for the house. We've worked with the city to renovate the house, and it's a beautiful space for the families. And families will stay with us up to a year, the mothers in particular, up to a year. We help with family reunification with those mothers, and we do the same in our recovery programs for the women in particular. We also have outpatient substance abuse, adult outpatient mental health, child and adolescent mental health, We're in about 5 elementary schools throughout the city as well, providing child and adolescent mental health services in those schools.
In the schools?
Connecting them back into our pediatric clinic. So it's broad.
It is very broad.
It
I
is
mean, I had
broad.
no idea that, we were in the schools.
Yes, we're in the
Because
schools, we're in the
yeah.
community, and part of my job is to make sure that people do know about it. So the opportunity to be here and be with you on this show is really important to me for people to understand the breadth and depth of services that we offer and the comprehensive nature of all of those programs as well. Wow. Yeah.
That is fantastic. There are things you're telling me about that, that I didn't even know existed. I mean, I thought I knew everything about Dimock.
And you've been there longer than I have. And I tell you, I have learned, even in the last year, I started off as CMO or Chief Medical Officer, and I've learned a lot about all the things that we do. And more importantly, I've gotten to know some of the managers that run these programs and have heard incredible stories of why they do what they do and how they do it. As an example, there's one amazing manager of our shelter, and I was walking with a potential donor in the shelter to show them all the services. And the manager told us that she had been homeless herself. And the reason why she works in the homeless shelter is because she understands what it felt like. And she treats people with the dignity and respect that she wanted to be treated with when she was homeless. And to have someone like that running our shelter is exactly what you want. Someone who understands, who treats our clients and families with respect, and creates a home for them when they feel like they have no home.
Nothing.
So that's just a small story of one of our employees, but there are so many stories of our employees who come from the community, who are there and who are dedicated, and it's just to be able to lead an organization like that is just amazing.
That is beautiful, amazing and beautiful. How, and since you were talking about the shelters, do you, let me see, how can I ask this question? Does the shelter house people that might just come off the street if they have the space, or do they have to have gone through Dimock first?
They have to go through DTA, or Department of Transitional Assistance. So we work, unfortunately or fortunately in some ways, it's a closed loop system. So they go through DTA and then they are assigned to our shelter. And then we work collaboratively with DTA to make sure that the families move out into permanent housing. Okay. One of the things that I find is really important to know about our shelters is that we're one of the few shelters that allows the male head of household to stay with the family.
Really?
What we see so often is that the male head of household, older male children are taken away from the family.
Yes.
And we don't do that. And I think it's just an amazing thing to see the families that stay together in our shelter and receive the services. They need to be together.
The family needs to be kept intact.
Yeah.
And for Dimock to be part of that and have that as part of a mission to keep the family together. Yeah. That's amazing. That is really amazing.
We do, as I mentioned, we do a lot of family reunification work, not only with the shelter, but the Umi's house that I mentioned, but in our recovery programs for women who may have lost their rights with their children. The visitation happens within our recovery programs, and we help them to build their case to get their children back. Some of the things that strike me the most are some of the stories from the women, but also the men in our recovery programs. When you talk to them and you hear about their struggles as men, as many of them as men of color, being pulled apart from their family, making bad decisions, leading them down the wrong paths, but how they've begun to turn their life around with the recovery services that they receive at Dimock, and how they're now back to being fathers and husbands and being a support to their family, going out and becoming employed. We do job employment training for them. We train them on how to interview, how to write their resume. They have the support from the other men in the house, and it's just a wonderful thing to see men come together in support of each other and to better each other. And the responsibilities that they take on as they move through the various phases of the program is incredible. And it's really, those are the stories that the men somehow hit me the most, because men are usually they're not usually vulnerable.
They don't get that much attention.
Yeah, they don't get that much attention.
And they're already being pulled apart.
That's right.
From their families.
That's right, and they don't expose the vulnerability because they're men. Everyone expects them to be these strong people, but to see them, I've seen men break down in tears to say how grateful they are for the services they've received and how it's allowed them to become better men.
See, that is wonderful. That is great. Now, I have, since we're talking about family,
Yes.
and you know how all of that comes together, I want to ask you a question about programs that you have for women and girls in the Dimock system. What programs do you have for them, and how can one get into those programs?
So the programs that come to mind as you ask that, clearly the recovery programs for women,
Right.
those are very much, they're very regimented, and by that I mean that there are group therapy sessions, there's always a touch point throughout the day for the women to be able to continue on their pathway to recovery. So those are really critical programs. For those who do not have substance abuse issues, we also have things like our Centering Pregnancy program. Centering Pregnancy are group prenatal visits that we do, so the women come together based upon where they are in their pregnancy to share experiences. And that program has been shown to lower infant mortality, the number of infant deaths, improve the health of the babies that are born, because the women are able to share with one another and learn from one another about how to be healthy and how to be better moms. So that's an incredible program that we also offer. We also offer women's health. We have the Dana-Farber mammography van that comes to us. So we make sure that women are taking care of themselves, taking care of their breast health. We're not afraid to talk about it and to educate patients around that. And so that's a really powerful tool that women can use as well. And our OBGYN program is a strong program where women can receive all of their gynecological services there. For any specialty services or procedures, we also refer primarily to Beth Israel Deaconess. But the women's program is very strong. The women's health program is very strong. We have wonderful nurse practitioners and physicians, some of whom are bilingual, who service the women in that program as well. So we are looking at other ways in which to build out programs for women and also for men, because the men get left behind when it comes to health care.
Yeah, they do.
So we've recently recruited a physician who will be starting with us next month who has a real focus on men's health, and we're looking forward to some of the ideas that he'll bring to the table around that as well. We also, in our child and family program, I know you asked about women, but I'm moving to men.
Yeah, I know, that's all right.
I can't leave them behind.
I know, we can't leave them out.
You cannot. Our child and family program, we are really looking at how do we focus on the fathers and creating parenting programs for the fathers to become better fathers, to share with one another and to provide education to the fathers and mothers, but in particular the fathers often get left out of the education that's provided to become better dads and better supporters. So we're looking at that as well. So we're open to ideas, open to innovation, and my goal is to bring on the people who will bring that level of innovation and excitement.
To the center.
Exactly,
Yeah,
exactly. So I'm happy to do that.
What teen programs do you have for young girls?
We don't have any programs in particular for young girls. We used to have a teen center. And
I thought so.
Dimock has had so many programs in the past, and the programs start off, they're strong. And I believe we had and this actually predates me, a pretty strong teen program that fell by the wayside. What we found, and we may certainly revisit this in the future, but what we found was that as we tried to have this program, a lot of the teens needed to go out and work. And we tried to have these after-school programs for the teens to keep them off the street, but what they really needed were jobs. And after time, that program was discontinued because we felt like we weren't making the type of impact that we needed to make. We do work in collaboration with other organizations. In particular, we have the MLK Scholars and Martin Luther King Scholars that work at Dimock. We work in coordination with some of the area schools to, if the teens want employment over the summer, we're open to that. But unfortunately, we don't have any teen-specific programs other than the collaborations that we have currently.
Are you thinking about having a teen program within the center again that will be housed in the center?
We may. It really depends on, I think, whatever programs we entertain, they have to be done well. We have to show that we're going to have the right kind of impact. And so we're open to entertaining those ideas if we can find the right combination to make sure that it does what we intend for it to do. Yeah. Wonderful. Yeah. Definitely not closed to it, though.
Oh, all right. Good.
Yes.
I'm glad. I'm glad. I have, at one point in time, wanted to ask this question to anybody. What is the community care program?
So community care is the program that really is the umbrella for all of our programs for patients infected with HIV or affected by HIV.
Okay.
And so we use community care because we want to take away some of the stigma. There's so much stigma, particularly in communities of color, around patients and clients that have HIV. So we're really fortunate to have a fairly large program. We treat about 200 clients with HIV. We also do rapid testing, and what's really innovative about the rapid testing program that is led by Dr. Bella Bashar, who's our boarded in infectious disease as well as internal medicine, is that we do rapid testing everywhere. We do it in our dental clinic, we do it in our eye care clinic, and I'm sure most people have never been to the eye doctor and been asked if they wanted to be tested for HIV. So we are trying to take away the stigma and do testing everywhere. And if someone is positive, unfortunately found to be positive, we can immediately link them into care within our clinic.
Oh, wonderful.
So community care not only provides direct clinical services by our infectious disease doctor, Dr. Bashar, but also a very wide array of case management services. We're helping patients and families with HIV get connected to housing, get connected to employment. We are accompanying them to their medical visits. We're doing medical case management, meaning that we're making sure that they know how to take their medication, that they're actually taking their medication, navigating the system around insurance. Our case managers do everything. And we expect the patients to ask them to do everything because that's what they're there for. We've received some federal funding to help with those programs, also some funding from the city and state to help support those programs. We received what's called Ryan White funding from the feds, which is primarily funding allocated for HIV services, but that's what community care is. With the renovation, with the renovation in the health center, we have them in a brand new space right on the first floor, and it's a beautiful space for people to get help in. And I walked in the other day, and one of the clients there was just raving about how much she loved the space and how much she felt like it was a real testament to how we respect our patients and clients about how beautiful the space was. You want to be treated in a space that makes you feel welcome. It makes you feel like people care about you, and that's what the new space looks like. And they were so excited. So I was really happy to hear that kind of feedback.
Yeah, because I've always wanted to know what community care was, and I kind of like heard about it or I read about it, but I never was quite sure exactly what it was and how that. How that worked at Dimock.
It's a wonderful program.
Oh, wow.
It's fully integrated into our adult medicine clinic. So you walk in and you won't know who has HIV and who doesn't, and you shouldn't. That's
that's
you won't know who has diabetes or any other chronic disease. So we really try to take away the stigma. We want people to feel comfortable when they get care, to feel like they have access to all the care that they need. And I think we're really achieving that under Dr. Bashar's leadership. She's an amazing physician that we're lucky to have.
Okay. Has she been here a while?
Yes, most of the docs, I think I'm the sort of,
New
maybe
kid
one
on
of the younger docs in the health center, although not so much anymore.
That's true.
And newest. There are many docs who've been there much longer than I have. There's one doctor in particular, I'm sure you may know him, Dr. Herbert Dreyer.
Yes,
who's been there over 35 years now, I believe.
How long?
35 years.
Oh my gosh, how do you know he's been there that long?
Oh my gosh, he started as the only physician in the health center with the only nurse, Carol Harrington.
Yes, Carol Harrington.
Who retired a few years back.
My best friend.
She was amazing.
My best friend.
But those are the kind of people I met.
Her daughter was one of my professors.
Oh wow.
Yes.
Yeah, she has an amazing family. But those are the kind of people that I met when I stepped on the campus of Dimock for the first time that made me feel like I needed to be there because they had been there for over 30 years.
And you were just like...
blown away again.
Yeah. There you go, blown away. It's like, wow, all the stuff that you've talked about and all the things that I've learned that are new to me about Dimock that I never knew about. And I wanted to ask you, your doctor's assistants, do you train them yourselves? Do you have a program for that?
We don't have a training program. Well, we don't have a formal training program, but what I will say, and this is part of the movement around patient-centered medical care, is that you're expecting people to work at the top of their license. So what I mean by that is a nurse or a medical assistant or a front desk staff person who comes in to Dimock will be challenged to work to the fullest capability that they have, that they're trained to do. So our medical assistants may have come in knowing how to take a blood pressure, knowing how to give a medication or check a temperature, but we also expect them to work as a team with our doctors and nurses around how do we manage this patient's care. Mr. Jones comes in, can't afford his medications, is smoking, maybe overweight. The medical assistant has a role in providing education to that patient The medical assistant's not there just to sort of triage the patient and get them in the room. The medical assistant may be taking some information from the patient, putting it in the chart for the doctor, getting the doctor or nurse teed up to understand what are the things that they need to focus in on when they enter the room.
Okay.
So we're expecting a lot more, and a lot of that happens on the job training that we provide because we want everyone to work as teams, and it's really wonderful to see how that happens. Our teams now are competing. What are the teams that do the most immunizations, and what are the teams that make sure all their patients get pap smears and colonoscopies, and they have charts that they follow, and it's a nice, healthy competition because everyone is working to make the patients more healthy.
Yes.
And to make the patients partners, to help them to become partners in their health. So it's an exciting environment. I remember I walked in the clinic last year and they said, Dr. Jordan, you know, your pap smear, the number of pap smears that you do with your patients is too low. We need you to increase. And my medical assistant told me that. I said, every woman that comes in here is getting a pap smear today. I don't care if she's coming in for a cold, but we're going to make sure that we have tested her and make sure we're preventing cervical cancer with these women. And it was so I'm like, it's on. We're going to make sure. And my numbers skyrocketed after that because I didn't know. And having that data as a physician helps you to make sure that you're touching on all those things.
Yeah.
And where, you know, you come in, and you may come in for a cold, but I'm also going to talk to you about how's your blood pressure, how's your diabetes, have you had your colonoscopy, the blood pressure we talked about, have you had your pap smear?
Oh, yes.
We're going to go through all of that. I have 15 minutes to do that with you, and I'm going to try and touch on every single thing in a 15-minute visit, or if it's a physical for half an hour, I'm going to cover all those things. But the medical assistant is the person that I depend on, and the nurse to tee those things up for me so that I make sure I cover all of them in that visit. So it's a lot of, it's fun, it's exciting, it's a great environment to practice medicine in, and I see the same thing happening in our educational departments and in our behavioral health departments too.
Yeah. Now, your education department, is that just centered around folks getting their GEDs so they can go further? Is that basically that's all that the education department does?
So it's the early childhood education. So it's the preschool, early intervention, Head Start, early Head Start, all of that. We consider that family education, and then we do the adult GED. So we have an array of educational services that we're providing. And our hope is that when a family comes in, that if the mom and dad need the GED services of the kid they're dropping off, from the kid that they're dropping off, that they're also able to access that. So we want to make sure that anyone from the community can come in and participate in our GED program. You just have to want to do it. And then we're here to help you, and then here to talk about how do you then move from your GED to finding a job, resume writing, interview skills, all of that's part of what we're doing.
We have another call.
Wonderful.
Hello.
Hello.
Hi. I wanted to ask one question regarding gerontology. Do you have a program that deals with seniors?
We don't have a specific geriatrics program, but we do have providers that are very well versed in dealing with and working with the elderly in partnership. But no, we don't have a specific geriatrics program.
There's a large senior population in this neighborhood.
Yes.
And I wondered if they came over for medical care, would they be able to be serviced?
Most definitely. We serve anyone and everyone who comes to us, and we've tried to make the commitment, and we are working on this, but first appointment within 2 weeks. So we're following that, we're tracking it, we're making sure that we provide access to the community, and that goes for anyone of any age. Pediatrics, typically we can see patients a little bit sooner, but for our elderly patients, we are definitely able to get them in, both for urgent care as well as for primary care. And then we also are part of what's called the Medicare ACO, or Accountable Care Organization, where we track a lot of different measures, that are focused on the elderly. How do we prevent falls with the elderly? How do we make sure that the home is safe? So although we don't have a specific geriatric program, we use a lot of the same methodologies that other geriatric programs use as we provide care.
Excellent. Okay, thank you so much.
Thank you for calling.
Okay, bye-bye.
That's great.
And Dr. Dreyer, The
Yep.
majority of his patients are elderly. They have been with him for the 30 years. Many of them have been with him for the 30 years plus that he's been there. So he almost is he probably wouldn't want me to say this, but he's almost like a geriatric provider.
Yeah.
But he sees everyone. But a lot of his patients fall into that category. And a lot of my patients, when I did primary care, were elderly as well. And you know, there are different things you need to look at for the elderly population that we focus in on in the care that we provide. Full spectrum is how I like to call it.
Call it, yes.
Yeah, from birth, and I think the amazing thing
Straight through.
all the way through.
You know, through the life.
That's right,
Once
through
the
the life
child is
cycle.
born.
And we have, because we've been in this business so long, we have generations of families that
Yes.
come to us.
Yes,
I've
you do.
taken care of the grandmother and the mother and the daughter and the granddaughter, which is beautiful to see, and to see how we have been able to impact generations of families in the community.
That is great. That is absolutely wonderful. I'm just thinking, you know, there are so many things that go on at Dimock.
Mm-hmm.
And my question is, did you ever expect to be the CEO of Dimock?
No. I can tell you that very quickly. Absolutely not. I
had to ask.
I didn't necessarily know that I'd be in a community health center either.
Oh, okay.
I was in academia. I was, working in the hospital in Baltimore. But there was when I came up and I saw the model of healthcare, I knew that was where I wanted to practice medicine. And my MBA, the background in business, gave me the opportunity to take on a role that was both clinical and administrative as a chief medical officer. And then as I spent more time externally, making connections with educational facilities, making connections with the community, the role of president and CEO started to make much more sense over time. But immediately, no, I had no idea, none. It's almost surreal. It's like when I look at President Obama, sometimes I can't.
Yeah, it's like
we have a black president.
I don't believe that.
Yeah, it's and that's not that I'm comparing myself to him at all, but just it's surreal in that way. Just like, wow, I can't believe I'm here and I'm doing this and I have this amazing opportunity to make a difference
doing this work
in healthcare.
Doing this work.
Yeah,
and it's great.
Yeah,
there's one other question I have to ask you.
Sure.
And it centers around the fact that I forgot. It's like there are so many things, and I'm wondering, where is Dimock going to go from here?
Oh, we're going to go so many places. We have a long way to go because the road is endless in terms of healthcare, but we are about transforming the healthcare system. We are about being a leader in healthcare for others to follow, showing that our model is comprehensive, it's efficient, it has a great impact on the community. So we're headed to establish ourselves as a leader in this field, and we'll continue to do that in everything that we do.
Dr. Jordan, thank you so very much for being my guest.
Thank you for allowing me to be here.
Definitely going to have you back
I'd
again.
Love to. I would love to come back.
That was, oh, wow.
And thank you to the callers, the people who called in.
Yeah,
I love that too. That was fun.
You like that, huh?
Yes.
Okay. So but.